Hi everybody, my name's Kevin Rogols. I'm the administrator at Kalkaska Memorial Health Center. You know, I think KMHC has really come a long way in the last year and a half. We have adequate personal protective equipment right now. We have adequate testing, media and testing kits right now. We have adequate vaccines available. We actually have the tools right now to actually fight the disease. And we didn't have that a year ago. We actually didn't have that 6 months ago, but we actually have that now. And I think that not only applies to us, but applies to hospitals really throughout northern Michigan. Now, in addition to that, I think we have the drive, and we have the cognitive focus and the heart to be able to fight the disease. We're going to be great. I think we're going to be great. And I think KMHC has done an exceptional job. We have taken care of very high acuity patients in our emergency department, on our inpatient units. And I'm very, very proud to say, you know, we have one of the larger long-term care services, senior services within the region, and we have not had a nosocomial COVID case. And that is a case where somebody came to KMHC in long-term care and got COVID here. That has not happened at KMHC, and I think that is an extraordinary event and an extraordinary effort by all of our staff. At Munson Healthcare, one day last week, we had 99 patients throughout the health system that were hospitalized for COVID. As of this morning, our rate of COVID cases per 100,000 patients actually exceeded 850. It's never been that high in the course of the pandemic for northern Michigan. The positivity rate for COVID testing is almost 18%. Again, never been that high. And what is also alarming about this third peak are the ages, right? We're talking about children. We're talking about young adults. We're talking about, you know, the portion of the population that may have escaped the first and the second wave, but it's not escaping the third wave. And unfortunately, the acuity of COVID is still high. The age of those who are being hospitalized is much lower than it was. And I think it's attributable to a number of things. We do have variants in northern Michigan, but I also think it's due to the fact that we're tired. It's been over a year, right? And you know, we're tired of wearing masks, and I mean, we all want to get back to normal. But we're not there yet. We're not ready for that. Now, what's different right now, though, is we have vaccines, right? And we have vaccines that are very, very effective. So we've actually been giving vaccines now for at least 3 months, a little bit over 3 months. And to date, we have given approximately 6,000 doses of Pfizer vaccine throughout our community. For those of you who are interested in getting vaccinated, anyone over the age of 16 can actually come to KMHC and get a vaccination these days. You can contact the hospital. We have a link that's available on our website that will take you directly to an online form that actually registers you. And then we will get back to you with a specific date and time to see if that would work for you for vaccines. We do provide at the present time, the Pfizer vaccine. It is a 2-dose vaccine. When we schedule you for the first dose, we'll also schedule you for the second dose, and that guarantees that you've got a spot, that we've got that second dose for you so that we can get you fully vaccinated. The biggest question I get is KMHC safe? Is it safe for me to come in to get my x-ray? Is it safe for me to come to the emergency department to get that surgical procedure, to get that lab test? And without a doubt, I would say that yes, KMHC is a very safe environment. In fact, I would say that KMHC is likely the safest environment in all of Kalkaska County because of what we know, what we have learned, and the practices we have put in place to actually create the safest environment that we possibly could.